SIM embarked on a second phase of COVID-equipped training, and this is a program that has been supported by SIM International's COVID working group. And the aim of this training was to equip churches and communities to be able to respond appropriately to the whole issue of COVID in Kenya. And this is since COVID hit our country back in 2020 in the month of March. This time there was a lot of uncertainty and unpreparedness in the government, in the public, and people were lost and confused. There was a lot of fear, and therefore SIM came at the right time. And that time I remember we did the first training, and we targeted to train as many people as possible. And through that training we managed to bring about 250 people who attended training virtually, and there has been a lot of overwhelming feedback from that first training that we did. Again in 2020, our country introduced the vaccination campaigns, which were not well received, basically because people had lost their confidence in the way the government had handled the whole issue of COVID. And then again, there were a lot of myths and misinformation surrounding the whole issue of vaccines, not just in our country, but across the world. And therefore, it was very timely for SIM again to offer training on the COVID vaccines. Which is at this moment that we came together as an implementation team, and we were able to develop a program on how we'd reach out to as many people as possible and train them about the COVID vaccines. And the target at that particular time was to reach out to 16 counties that had not been trained initially. And we did that. We were able to go to a number of counties, from as far as Lamu County, we went to Tana River, we went to Kwale County, we went to Isiolo. I remember we went to Turkana, West Pokot, Meru, Tharaka Nithi, a number of counties, and we were able to train the 16 counties and over 65 sub-counties. This training really brought out a lot of discussion, that indeed pastors and community leaders admitted that they did not have the right information about the vaccines, and even some said that they had actually warned their congregants against being vaccinated. Therefore, it came at the right time and had a great impact. I also appreciate greatly the implementation team that I had, Ernest, Simon, we also had Grace, and later also Victor came on board, and we were able to do so much. And they also received feedback from the people that were training, and some of the feedback is what we shall be sharing with you in this video, and also what they were able to gather themselves, as many of the participants shared with us.
I am Ernest Nyingi, and today we've been talking to the church leaders and pastors on the whole idea of church's response to crisis, and especially with COVID-19. And we're just exploring, is there a way in which church and leadership can be able to respond differently? We realize that when crises come, it is expected that the pastors and the leaders would have a positive response towards the challenges and be able to help the church respond positively. And so we just looked at how do we continue to disciple, how do we reach out to people, how do we help church respond in the way that Christ would, in terms of sharing love, being compassionate to the people who are in need, and just bringing solutions where you have care for people and in communities and responding positively so that the lives of people can be changed. And we had a great time. It was nice to see them seeing their need to figure out the whole idea of that they are leaders, they need to be making a difference, they need to think about vision, and they also need to execute practical things that can change the lives of people. So it was a great opportunity for us to just support these churches, and this work is actually making a difference.
Yeah, when we started off, when I was teaching them about the COVID vaccine, I started by asking them the myths, what they know about it. And the interesting thing is that you see the myths that are written in the manual, they're exactly the things that they brought out. And to them, it was a reality. That is what they thought about the vaccine. Because we realized that there are very few of them who've taken the vaccine. But now I'm hoping that will change. By the end of the class, you could see the impact that they had. They had a different perception of it. They knew the difference between the myths and the truths, and believing in the correct sources. So I think today was a success. We just hope that will translate to most of them getting vaccinated, and them taking information from the ministry and other reliable sources positively. It was amazing.
So we went across the various counties, and the participants gave overwhelming feedback on the training that we were giving, and we want to sample a few of what we heard from the various participants even in this video, as they had to share with us.
I'm so grateful because of this organization which decided to come and give us this training on how we are supposed to live within this time of COVID-19. We have really learned a lot, and the stigma that we used to have, now it is cleared. We used to have to hear so many things about the disease, that it is a punishment from God, that it is the number 666 that has come. But through the teaching of our facilitators, Harrison and Simon, they have really taken us through, and now we are sure that this is just a disease like any other. It is not a punishment. And now from today, we have become agents of spreading the good news, telling people about the disease, that it is not the end. We are going to teach them and reach to everyone, especially those who we are not within, who do not take the training. We are happy, we are grateful for those people who have organized this training. We want to thank them, those who have facilitated our facilitators, so that they will be able to reach us. So many people lack the knowledge, and that is why most of the people have even not agreed to be vaccinated. But we have seen that this vaccine is good, though it cannot be 100%. It is good, and it is very effective. For those who have been vaccinated, even if they get the disease, it will not beat them, it will not overreact in them. So it is good. We are happy, we are grateful, and we are very thankful. And we would like you to pass our gratitude to that organization abroad, because they have really taught us they have really taught us good things, and we know we are at a better position now.
I want to thank this organization SIN because of this initiative that they took for giving people information about COVID-19. So as a church, we should be there as a good example of showing people that we need to do, like going for vaccines. We need to go for them. All vaccines are very important because they are going to give people a good immune so that it can curb this pandemic. So thank you so much, and God bless you because of this noble work that you are doing. God bless you so much. Thank you.
The other thing that I also want to mention is that in the training we faced also other emerging issues that our people have been going through. And of course, we all know about the HPV vaccine, that is a cancer vaccination that has also been going on. And unfortunately, people also have very little information about that vaccine. And in fact, even pastors were asking us to also share information about it, because also members are going back to them for recommendation whether they are supposed to allow their children to go for the vaccination. The module on trauma and healing was very well received, and pastors admitted that many of them go through trauma unknowingly, and they also handle members who are traumatized, but they don't have the skills and ability to help them out in the process. And of course, we also went to a number of counties that have had issues with the Al-Shabaab attacks and trauma cases, many in some of those areas like Lamu and Tana River.
My experience today has been wonderful. Looking at COVID-19, it reminds me of HIV/AIDS. It reminds me of cholera in 1973. It reminds me of many other pandemics that happened earlier and how people reacted to them. We are looking at trauma. Many times we are looking at trauma in terms of accidents, in terms of pandemics, in terms of say attacks by the anti-government agencies such as Al-Qaeda, but we never look at it in terms of how ministers feel when they are ministering to people who are hurting. And we realize that when we are hurting, we will hurt other people. And that's something for ministers to take home, to sleep over, to see how best they can renew themselves so that they can deal with their own traumas before they deal with the trauma of their flock. And I think that was very powerful. I think it needs to be repeated over and over again, because we are losing many ministers to vices and nobody understands why they're going that way. We need to help one another.
So these are other concerns and emerging issues that have come as a result of COVID or related to COVID. And we believe that God is going to continue giving us the grace and the ability to handle these issues and equip our members to be able to respond appropriately, and more importantly, to avert anything that would hinder the gospel of Jesus Christ to be preached to the people. We are thankful to SIM International, the COVID working group, and also thankful to SIM Kenya that has offered facilitation for us to run these trainings. And we want to believe that we shall see the impact of what we have been doing. Already much has been felt, because we've seen churches going to the extent of partnerships with the Ministry of Health to do vaccinations within the churches, and others have done very great campaigns within their churches, had forums where they've created awareness on both COVID and also the vaccines. And this has highly increased the rate at which people have been vaccinated. A very good report came from Lamu, because before we went to Lamu, there was a very low vaccination rate. But after this, the pastors took it to themselves to partner with the Ministry of Health. And, months later, it was reported that Lamu has increased in vaccination uptake. So we really can tell that there has been impact of the training that has been conducted across our country. And therefore, like I said earlier, we appreciate all those who partnered to make this possible. And I also extend more appreciation to my implementation team, that we have worked together to ensure that this has been achieved. So God bless SIM, God bless our country, Kenya, and we believe that as we continue, the gospel of Christ shall reach people to all ends, as again our Lord Jesus Christ commanded us. So asanteni sana.